Hi YouTube. So this is a video about some latching tips for nursing and breastfeeding that I thought could be helpful, since I did get to run the gamut of the suggestions and tips and things. Oh gosh, sorry, horrible smell coming from outside. But can't really do a demonstration right now because this guy is not hungry. He wants to jump and play and be a boy. Yeah. By the way, it's not cold outside. The blanket is sort of being used as a very, very large burp cloth because he's teething right now, so he drools like a faucet. Anyhow, this is here. Latching tips. So one thing that a lot of first-time moms get completely wrong is when you're going to grab your breast to help get more breast tissue into the baby's mouth, most women go for like a sandwich hold, something like that, which isn't the part that's wrong. It's the fact that usually baby is in a side-lying position against your body. So either a cross cradle or a football hold, which means baby's ears are facing you rather than baby's nose. So if baby's nose was facing your face, then grabbing your breast like this would make sense. However, doing that actually makes it harder to get tissue in the baby's mouth. So what you normally want to do is what we fondly termed the U grab. And what that means is your hand should be making a U and go underneath your breast. That way, when you squeeze it to help insert it into the baby's mouth, because most newborns' mouths are just tiny, 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 it's being sandwiched in the same direction as the opening of the baby's mouth. So that is one thing that's incredibly useful. I know that I did it wrong a number of times before common sense was sort of knocked back into my head. But yeah, so that would be number one most useful. That'll help you figure out whether or not there's anything else going wrong. And excuse still the bedhead. So another useful latching tip is make sure you're both really calm. So if you're getting frustrated, or if baby is getting frustrated, if you're by yourself, which I know happens a lot with first-time moms, those first 6 weeks you're home, you know, your significant other or whoever's around to help can only be there for so long sometimes. So take a step back, stand up. You know, sometimes the baby just needs a little motion or a little sound. A white noise app on your phone is very useful at that stage. I wish I'd realized that. But pick the baby up, put them on your shoulder, put your breasts away, walk around, get a cup of coffee. Yes, I'm advocating coffee drinking for breastfeeding moms. Unless you discover that your little one is extremely caffeine sensitive. Sometimes I don't know what I do without my coffee. So get your coffee, walk around, calm down. Even if it's just one of you that's upset, you know, if baby is trying and you're getting upset, just take a step back. Take a few deep breaths, whatever you need. Turn on your favorite TV show, put in a movie, change the atmosphere a little bit, because you don't want it to interfere with breastfeeding correctly. You also don't want a sense of tension and fear and confusion and frustration to be associated with your breastfeeding experience. And I know that was huge for me as well. There was a lot of frustration for us. So a thing that was important for me was just to take a step back. And I just, after an hour or two, and that sounds like a really long time, but he was very ineffective in the beginning, I would give up nursing him for a little while. If I absolutely had to, I'd say, all right, this is now, because we had to supplement because of his weight, I'd say this is the time that I or Dad gives him a bit of supplement in the Haberman bottle, just to give me a chance to reset my energies. What are you doing? So that is another huge important tip. Yet another one, have a really low pain threshold. I was told over and over again, and this probably helped me, though I was really optimistically stubborn about it. It helped a lot in identifying that there was a problem. Having a really low, like no matter what your pain threshold is, count how long it hurts. A 5-second threshold should be all that's necessary. Tripping over my words. After 5 seconds, I mean, even in those first few days, people say that sometimes it hurts. Hurts is not the right word. The skin on your nipples is a mucous membrane, kind of like the insides of your lips. So, you know how your lips feel when they've been abused a little bit, if you've been out in really cold, windy weather, etc. And they heal really quickly as well. So, if your nipples feel chapped, that's one thing, and the lanolin and nipple cream can help with that, reinfusing the moisture and then as a protective barrier. But it shouldn't hurt. Hurting and chapping are two different things, because usually chapped lips don't hurt unless you inflict some sort of damage to them. If you pull it too hard or too fast and then split your lip, that hurts. The split, not the fact that they're chapped. So have a really low pain threshold, and if you exceed that pain threshold over and over again, get help. It could be your positioning, it could be your latch, which positioning is not such a big deal when they're his size, but in a little baby it makes a big difference. It makes a really big difference. Make sure you're pressing the baby tight up against your body, which I can try and demonstrate with my little wiggle worm here. So I mostly nurse him in sort of a modified cradle, which he's chewing on a teether right in front of my breast. But when he was an infant, I had to make sure his body was completely aligned. He was having none of this. And make sure I was pressing him really tight up against my body. Because you have to understand that newborns, you're not going to crush them. You're not going to squish them. I'm sorry. Here you go. Yeah. You're not going to squish them. You're not going to crush them. I had to be told over and over and over again. They just came out of your body. They had no space. And suddenly there's this huge world. So being squeezed and held up tight against you is actually very comforting to them. Sorry. Hey. What's the matter? Hi. Hi. Okay. So I think that's all I have time for right now, because my little one is wet. So I'll be back with more later. Thanks. Bye, YouTube.